Hi, this is Dr. Nemechek. I want to give you a quick overview of what we call the Autonomic Advantage Brain Recovery Program. It's based in the fact that more data is telling us that the autonomic nervous system, which is comprised of the sympathetic branch and the parasympathetic branch, are actually responsible for many of the most overt symptoms that you see with traumatic brain injury and other forms of non-traumatic brain injury. In particular, the sympathetic branch here is responsible for regulating blood pressure to the brain and is commonly the source of the headaches, the lightheadedness, the confusion, and the anxiety that people will experience when they have a concussion. Now, normally we should recover from concussions, but what we're learning is a large part of the population is suffering from a process known as metabolic inflammation. Back off here a little bit. You can see metabolic inflammation is the centerpiece. This slide here represents kind of what's going on metabolically to our physiology in general. It's an outlay of all the science that we're seeing in about the last 15 years. And briefly put, metabolic inflammation is a trigger and driving force for many disorders that we're seeing now, and without it, most of these conditions would not exist. In terms of concussions, it is responsible for chronic concussion effects and poor tissue repair that we're seeing up in the brain. It in and of itself over time can actually add to damage in the brain. There are multiple sources of metabolic inflammation. Here is kind of odds and ends. Tobacco is a common one. Imbalance of intestinal bacteria called small intestinal bacterial overgrowth, SIBO. Actual damage to the autonomics itself. The parasympathetics are responsible for controlling inflammation through the body, and when that is damaged, you have these very high levels of cytokine production. And then over here is overnutrition. This is the damage that particular nutrients can do to our body and our brain in particular, and a particular concern we have is linoleic acid toxicity. This shows what's happening. We used to be these white mice. These are mice that are getting concussion. As it deflects down, he's not doing well, but you can see as we go along, the mouse is continually repairing the damage. But unfortunately, many of us have become the black mouse here. He goes along, gets the same injury, has worse damage, has partial recovery. Now the brain's susceptible. Each individual injury is adding greater and greater levels of neurological impairment. And this third one you can see here is a catastrophic event for the mouse. So because of metabolic inflammation being produced throughout the body and in the brain, the stem cells and other restorative mechanisms are not able to perform correctly. There is an additive effect as well. We call it cumulative brain injury, that each of these injuries is stacking one on top of another. So after 2 or 3 effects, you can have brain damage that might be akin to one large massive traumatic brain injury, for instance. And this is showing increasing microglia activation. These are white blood cells that are spinning out of control that are actually preventing the repair mechanisms from working and adding to the damage. You can see as each one happens, you get this accelerated process. If you multiply this by 1,000, that's CTE in NFL football players, with each hit having a additive effect. Again, we're calling this now cumulative brain injury, and it is a chronic problem throughout the population in general. But we have a solution for it. We've developed over the last several years a process that we call Autonomic Advantage, and it is capable of restoring autonomic function by a suppression of the microglia activation, and you see a rather remarkable level of not only autonomic improvement, but resolution of concussion symptoms, traumatic brain injury and non-traumatic brain injury symptoms that may have been persistent for even decades. And the Autonomic Advantage program consists predominantly of variety of treatments that we will use depending on the individual. Most of these are used in most people. Through these treatment options, we'll see a reversal of neuroinflammation within the brain. We see autonomic recovery. You'll actually have improved tissue healing and a resolution of chronic pain in many patients, since this is actually just a reflection of poor inflammatory control by those multiple mechanisms that we discussed earlier on. And within a handful of months, you're going to see symptoms get better, autonomic testing gets better, people have better focus and physical reflexes. Tobacco cravings will drop. You can find other information on this site talking about how nicotine in tobacco is just a way to surpass sympathetic damage to the brain, as well as you'll get a great improvement in anxiety, and in particular performance anxiety. As a quick example, this is a partial result on concussion damage that had occurred approximately 30 years ago in this individual. You can see the red and the blue. We're measuring red is sympathetic, blue is parasympathetic, and we want the results to be within these bars to be within the gray zone. So you can see these are very high. He's having poor regulatory problems here. On the stand test, this one is very low, which is causing a great deal of decreased cerebral perfusion in this patient. He has a little increase of parasympathetic activity, and after participating in the Autonomic Advantage program, you can see now he's had normalization of his tests. I'll go back. You can see these were very high. They've come down to normal. Again, these were aberrant here as well. They've normalized, and that is just through this basic process. This is revolutionary. We presently don't the science up to this point has told us that this should be impossible, but what we're discovering, the brain has a unique and rather beautiful ability to restore neurological function even decades later. I hope you find this information useful. There's more screencasts like this throughout the site, and welcome to autonomicrecovery.com.